heard about small intestine bacterial overgrowth, or SIBO, but maybe you don't know whether it's relevant to you. SIBO is one of those conditions where there is a lot of misunderstanding and even some GPs aren't familiar with it. And this means you can be left trying to figure out for yourself what to do and how to get tested. This week's episode of the Inside Knowledge podcast, I'm going to review testing for SIBO, how you'd go about getting a test, how actually to do the test, and whether it's worth it. I'll also be digging a bit into how to prepare for the test and how to interpret your results. So let's get going. Welcome to episode 103 of the Inside Knowledge podcast for people with IBS. I'm Anna Matson. SIBO is a condition that a lot of people I work with have or have heard about because most people who have uncontrolled IBS symptoms have done a lot of research, and probably that's why you're listening to this kind of podcast, is that you're doing your own research into potential causes for your ongoing symptoms. So this is something people have come across, but as I said in the introduction, a lot of people, even doctors, are not that familiar with the condition and how to diagnose and treat it. So today is going to be about the testing, how to prepare for it, what you do in the run-up, and also how to interpret the results. As a quick reminder, SIBO stands for small intestine bacterial overgrowth, which is about an excess of microbes. The microbes can cause bloating and gas because the microbes are fermenting any food and carbohydrates that you eat. So they are creating excessive gas. The microbes can also interfere with the normal digestion processes, such as the production of digestive enzymes, such as bile salt reabsorption, which can lead to bile acid diarrhea. And you can also get changes to some of your nutrient absorption. So having a lot of these gas-producing microbes in your digestion is not great. And if you're someone who has SIBO, you will know that the symptoms can be very difficult to live with. The symptoms are very similar to IBS, and that is where we need a test to work it out. You cannot guess that you have SIBO. You cannot make an assumption that you have it because the symptoms are so similar to other conditions, especially IBS. And IBS can have a multitude of causes as well. If these symptoms are so similar to IBS, who should be going to get a test for SIBO? Like, how would you know that you had it? Well, the only way to know you've got SIBO is to run a test. And the cases where it might be indicated to run a test is if you've got persistent IBS symptoms that just haven't responded to all the normal interventions. The first level basic changes, the traditional dietary advice, that includes eating regularly, eating good healthy mix of fruits and vegetables, whole grains, protein, all of that basic advice, plus exercising, managing your stress levels, all of those things really important as a first line intervention. Maybe you've tried the FODMAP diet. That's like the next stage is trying some specific IBS diets. Maybe that hasn't helped either. In these kind of cases, if you've got ongoing uncontrolled IBS symptoms, it is worth looking at the next stage of investigations. And as part of that, SIBO may play a part depending on your symptoms. The types of symptoms that are particularly common in people who have SIBO are bloating, and particularly bloating after eating within 1 to 3 hours after eating. So thinking when the food is starting to hit your small intestine. If you get a very noisy digestion, there's a lot of activity in the small intestine, the microbes are creating that gas, and maybe the part of the problem is as well, if they're interfering with your digestive enzyme production, then you're going to get larger molecules of undigested food traveling to the large intestine. And that is where your large gut bugs can start to ferment and create problems. So it's like a knock-on effect if you're not creating the digestive enzymes. Another time you might suspect SIBO is if you have had food poisoning, because A previous case of food poisoning can affect the motility in the small intestine. Listen to episode 10 that I did right back in the beginning of this podcast about post-infectious IBS, because I cover a lot in there, the mechanism of how a previous incident of food poisoning can affect your motility even up to a couple of years later. It just can change the motility because you're changing the microbes and sometimes changing the immune system so that your body is not moving things through the small intestine as quickly as it should do. So that would be another incident where you might consider testing for SIBO. And interestingly, if you notice that your digestion is better when you take antibiotics, that could be an indication that you have got an overgrowth of microbes that are actually being reduced by the antibiotics. So maybe you had, I don't know, a chest infection and you take the antibiotics and your digestion gets better whilst you're taking them or for the next few weeks. That might be a sign that you've reduced your microbial overgrowth. In an ideal case, you will work with a nutritionist before you start taking a SIBO test, and that is so you could waste time and money by investigating for SIBO if you don't really need to. Before you get a SIBO test, I would check that your diet is broad, balanced, eating a good range of foods. You've tried to reduce the most common gut triggers, things like caffeine, alcohol, smoking, reduce those to create a good health overall, like not just focusing on your digestive system. And also you've been to the doctor and ruled out other conditions like celiac disease, bile acid diarrhea. Now, the way that we want to check for the microbes, there is a method which is a small intestine biopsy. Take a sample of the fluids in the small intestine, so through the stomach into the small intestine. Part of the problem with that, though, is that it only measures the top half of your small intestine. So the small intestine tube is extremely long and you can't get to the bottom of it in that procedure. It's also very expensive, not very pleasant to go through. And so the best test that we do have available for SIBO is a breath test. Now, if you're wondering why the gases would come out in your breath when it's come from your stomach, that is a good question. So bacteria in your small intestine are going to ferment carbohydrates like high FODMAP foods, wheat, cabbage, chickpeas, lactose, a whole range of good healthy foods. When these bacteria eat them, they produce gas as a byproduct of that activity. And those gases don't just stay in your gut, although some of them do. They travel through and pass out as farts, or they might come back up as belching. But some of the gas gets absorbed through the small intestine wall and into the bloodstream, and there it will travel through the blood to your lungs to be breathed out. So that is how we can measure the gases, because the gases we're looking for is hydrogen and methane, and a human body doesn't normally create any of those gases. So if you have got high amounts of hydrogen in your breath, they must have been created by bacteria, the same with methane. So these are the two types of SIBO that we're looking for. We're looking for hydrogen SIBO and methane predominant SIBO. We have recently changed the name of SIBO to Intestinal Methanogen Overgrowth, because production of methane gas can also happen in the large intestine and it can produce very similar results. So it's not just in the small intestine that you get methane overgrowth, and also the bugs that create the methane are not strictly bacteria. They are called archaea. They're similar to bacteria in that they are tiny one-cell organisms, but they are not bacteria. So the name is Intestinal Methanogen Overgrowth and SIBO, small intestine bacterial overgrowth. The way that you're going to test for SIBO will be to measure the gases in your breath, and we're going to look for the hydrogen levels and the methane levels over time. But in order to get a good baseline, what you have to do is try and not have any carbohydrates in your small intestine in the run up to the test, so that when you drink a sugary solution, we can measure the production of gases as that sugar is traveling through the gut. So you're going to do a prep diet where you're not eating any fiber for a whole day, then you fast overnight, and then you take the test. There are 3 different ways we can measure the gas production as we drink a sugary solution and time the gas production through the small intestine. And these are lactulose, glucose, and fructose. And each of them has got plus or minus points and are used by different practitioners. And actually, a couple of doctors who I've been following for a while have been experimenting using different sugary solutions and getting different results. And I think that's because different microbes respond to different types of sugar. So let's have a look at them. Lactulose is a disaccharide, so it's made up of 2 types of sugars, and it's not broken up by our own gut cells. Our body cannot digest lactulose. In fact, it's actually used as a laxative at high doses, and so you can get it quite easily from a chemist. Now, I am based in the UK, but I know in the US, you cannot get lactulose without a prescription. But in the UK, it's freely available. It's very cheap. Now, it's not going to have a laxative effect in you. You're just taking 1 dose of it 1 time. But the good thing about lactulose is that because it's not broken up and undigested by our body, it will travel the entire length of your small intestine. And then we're going to be able to measure the gas production throughout the small intestine. The other 2 sugars that are used are fructose and glucose, but because they get absorbed, you might not pick up the full range of the small intestine. So glucose may be rapidly absorbed in the top half of your small intestine, and then you wouldn't necessarily see if you had a huge rise in gases as the glucose travels to the end of your small intestine. But fructose, interestingly, has been shown by a couple of other people I've been following to be quite effective to pick up different types of microbes. So again, it's not something that I use, but could have value. And so they are available, those fructose tests. But I use lactulose on the basis that it's not well absorbed and we can read a good result from it all the way through. So let's talk a bit about how to actually do the test, how to prep for it, and a few little tips. In order to prep for a diet, I'm going to talk about if you're doing a test at home, because if you're doing a test from the hospital, I'm assuming they will have given you some very clear instructions, and I don't want to contradict anything that they're saying from the hospital. So this is just if you are doing your own home test and you're doing it by yourself. The process is the prep diet, which is 0 fiber. Then you're going to fast for 12 hours. Then you need 3 hours at home to sit and take this test. So in order to prepare for the test, you need to start a couple of weeks before, ideally. And in terms of preparation, you should not do a test directly after taking antibiotics or directly after taking antimicrobials. So if you have taken any of those, like waiting for a week or 2 and then doing your test, just because it allows your microbiome to settle down a little bit. Then the day before, you want to try, for 1 or 2 days before, you want to try and stop taking all your supplements. Stop taking laxatives, things like digestive enzymes, hydrochloric acid, anything that is changing your digestion, including proton pump inhibitors or acid suppressing medication, if it's not prescription driven. So you don't really want to be taking anything that can upset your digestion or change it, because you want to get a true picture. In terms of the prep diet, you're just going to eat very plain foods for 12 hours the day before the test. That includes just plain grilled or baked fish or chicken, white rice, white potatoes. You can have white bread as well, and eggs as well. And then you can also have black tea and black coffee. So you can drink water, tea and coffee, but you can't have anything with any fiber in it or anything with any taste. So no sauces, I'm afraid, no interesting flavors, not even any herbs or spices. I would just keep it completely plain. You want to make sure that you are getting the maximum out of this test, especially if you've paid for it yourself, and they're quite expensive, around £150. You don't want to mess it up by not following the prep diet correctly. So the prep diet should be followed for 12 hours. Or if you're very constipated, you want to go for a whole day and a half before you take the test. And that is to reduce the amount of fiber that may be sitting in your small intestine. Then you're going to fast for 12 hours. So no food at all, only water. And then you're going to take the test. Now, in the morning when you get up, you can brush your teeth, but do not use toothpaste because some of the sweeteners in there can interfere with your digestion. So you don't want to mess around with brushing your teeth, ideally. You don't want to smoke. I wouldn't recommend smoking anyway, but do not try to do too much before you do the test, basically. You want to just wake up and do it straight away. They also suggest that for this 3-hour period where you are testing your breath at in these regular intervals, that you don't do too much running around. So you don't dash around the house trying to tidy up in between the 15-minute segments. We want to just wake up, sit and do the test. And then as soon as you finish the test, you can eat normally, get back to your normal diet, and you'll probably be pretty hungry. So in terms of a preparation, the aim is to have as little food in your digestive tract as possible. And there will be some in the large colon, that's fine, but you don't want to have anything in the small intestine. So once we're doing this prep, then you're going to take the breath test. What you should get back is you should see a graph that is showing when the gases start to rise, and you should also get a table with the exact parts per million. So that is what they're recording, is how much gas was there in a million particles of air that's coming out of you and breath. How much of that was hydrogen? How much of that was methane? And then they're going to look at the combined total as well as the individual gas levels. It's bit complicated to work out if it's positive. It's not as easy as just saying you are positive or negative. Let's take the example of hydrogen. So to become hydrogen positive for SIBO, we're looking for a rise of 10 parts per million within the first 60 minutes. So say you started at 3. If your gas levels in the first hour of taking the test went up to 30, then you're definitely positive for hydrogen SIBO. In America, they use different guidelines, and some testing companies will also use the American guidelines, which are a rise of 20 parts per million in the first 90 minutes. So this is a very different way of interpreting the results. You're still looking for a rise, but you've got a much longer time period, and also it's a double rise of 20 parts per million. The European guidelines are all about this 10 parts per million rise in the first hour, and then they've said, well, after about an hour, then maybe it'll get to the intestine, which for some people it could if you have got a very fast small intestine transit time. I tend to err on the side of caution and taking the longer 90-minute approach. And this is what a lot of the test companies do as well. Because, yes, it's potentially more likely to be in the large intestine, but you can often interpret that by looking at the results. Sometimes we'll see a double rise, so it will go up and then down and then up again when it hits the large intestine. So that's what we're looking at for hydrogen. For methane, if you've got very high methane overgrowth in the large intestine, then you will normally start your baseline results at a high level. So it could be 10, 20, 30, 50 even. So you will still have a residual level of methane gas in your breath if you've got a lot of methane producing microbes in your large intestine. No matter how much you fasted for, they are still there. They are still creating gas. And that is why your baseline could be really high. And this is why we call it intestinal methanogen overgrowth, not strictly SIBO. So in order to become positive for methane, then they're normally looking at any level that's over 10 parts per million throughout the whole of that 60 or 90 minutes. You also would look for a rise to see whether the methane changes as the lactulose hits the small intestine. I'm interested in that. Is the methane consistently high, or does it actually rise as the lactulose hits the microbes in the small intestine? Now, there is a third type of SIBO that I haven't mentioned yet, which is hydrogen sulphide, which doesn't get tested on any of the tests that you can do at home in the UK. So you can't test for it. In the US, you can, and there is a test that tests for all 3 types of gas, but we don't have access to that here. What you could look at, and what some people say will indicate a hydrogen sulfide production, is a flat line of gases. So that gas level does not rise at all, and it stays pretty low for the whole time. That is not diagnostic of hydrogen sulphide SIBO, but it may indicate it. And this is really difficult because we don't have a set of diagnostic criteria for hydrogen sulphide SIBO in the same way. So you could make a guess based on your symptoms, based on the gas readings of hydrogen and methane. So you may be able to interpret that as hydrogen sulphide SIBO. It can be quite difficult to understand and interpret these breath test results. So ideally, you will work with someone who knows what they're talking about. I sometimes will get clients who've come to me where a previous nutritionist has run the test with them, but then they don't really know what to do with the result. These breath tests can be tricky to interpret because you can get false positives if your transit time is really fast. You can get false negatives if the testing was cut off too early, for example, and you actually did have a rise in the small intestine, but you only took the 60-minute mark. And if you use glucose or fructose, it's potential that that has been absorbed at the top of your small intestine, and you could have an overgrowth in the latter part of your small intestine, but it's not been picked up in the breath test. So there's lots of ways that this can be muddled and misunderstood. If you get a test in a hospital, which is definitely possible on the NHS, and some gastroenterologists will recommend it and run it, they may only use glucose for testing, and they may only test for hydrogen, which I don't think is giving you the full picture. So also people will say, I've been tested, but it's not really giving us any information because they only tested for hydrogen and they only used glucose to check. So this is understanding a SIBO test is a little bit of an art. Now, stool tests cannot diagnose SIBO and should not be used to diagnose SIBO. Definitely not. The reason is because stool samples are only giving you a snapshot of the waste products in your large intestine. Even in the large intestine, there are a lot of bacteria that do not come out in the stool, can be different depending on the time of day that you take it. We know that there are certain microbes that are more abundant in the beginning of the day to the end of the day, or the other way around. We also know that day to day it can really change. So stool tests can give you variable results anyway. But the added complication when you're looking to diagnose SIBO is that we're looking for things in the small intestine, which is higher up your digestive tract. And therefore, there is even more possibility that you are not picking up microbes because they are not coming out in the stool. They are living in the small intestine, in the mucus lining. They do not get shed in the same way. Now, there are a couple of types of bacteria that when high may indicate certain types of gas would be produced. For example, desulfovibrio, Methanobrevibacter smithii. These are two microbes that live in the large intestine that can produce methane, or they can produce hydrogen sulphide. That's the desulfovibrio one. But it doesn't necessarily mean that you've got SIBO. It just means that you've got those bacteria in your large intestine waste. So I don't recommend testing for SIBO with the stool test. Question people will ask is, where can I get access to these tests if I'm not working with a practitioner? And I totally get it. Sometimes you don't have the money to pay for a nutritionist to help you and to get the test. So you want to try and work it out on your own. Now, there are a number of tests online that you can get at home, and they're all pretty much the same. I would try to investigate whether it's a reputable company. The test that I use is practitioner only. For people I work with, I can help you get a SIBO test. So I hope this episode has been helpful in just explaining how you get tested, what it's all about, and what to do before the test. If you still have any questions about SIBO testing, then please do get in touch. Let me know what you want to know more about. I'm happy to do more episodes about SIBO or anything to do with helping you get a diagnosis and working out if SIBO is your problem or not. I'm launching something in the autumn called SIBO Strategy Sessions, where there's a lot of S's in this. SIBO Strategy Sessions in September. It's like a little mini clinic where you can come and ask me questions in a group about SIBO, and there'll be some educational things to support it that you can read in your own time, but it's a much more low cost way of working with me on SIBO, and I will also help you in that, interpret any results, help you with supplements. Now, I'm not a doctor, I can't do any prescription for antibiotics, but I can also talk to you about what to do about a SIBO test and how to work with a doctor in getting it treated. The link to sign up for that is in the show notes. Take a look if you're interested in getting some support with SIBO. Okay, that's it for this week. Thank you very much for listening to this episode of the Inside Knowledge podcast. Better digestion for everyone.